guys, how are you doing? So welcome back. This is the third episode from this series about my dog having lymphoma. I don't know if you've seen the previous two episodes, but my dog was diagnosed with cancer, with lymphoma. So now he's going through chemotherapy, and I'm seeing all kind of side effects with the treatment that he is receiving. So I want to journal and put everything I see that's happening to him, and to create awareness for other people who are going through the same thing. It might be very useful when you start chemotherapy or when your dog is diagnosed with lymphoma, and you know what you might expect or what might happen. They say 80% of the dogs that are treated with this protocol don't have any side effects, which I think it's a very, very positive number. I cannot say too much about it because my dog did have and still has side effects from this treatment. So I cannot really say much about this kind of percentage. This is what is presented by doctors. And I'm not a doctor. I'm not a vet. So this is just my personal opinion and my personal experience with this protocol. So let me tell you a bit about him. He's a Westie. He's 14 years old. He was diagnosed 2 months ago or 3 months ago almost. I'm not very sure of when it was anymore. He was diagnosed with a tumor on the spleen. He was operated and they took the spleen out. The surgery went well, no complications, no bleeding. They even sterilized him in the same moment, so everything went well. They sent the spleen and the tumor for a biopsy, for a test, and it came out negative, that is not cancer, so it was benign. 1 month later, after we received the test result, his lymph nodes from the whole body, they became swollen. So the ones from the neck, the ones from the chest, behind the knees, inguinal and under the armpits, they were all really swollen. So of course he went to the vet. They took a sample from the lymph nodes on the chest, and it came out that it's a lymphoma. Of course, it's a very it's a very discouraging diagnosis in the end, because you don't know what to expect, and all that you want is for your dog to have a very good life, to be happy, to be healthy, to be joyful, to jump, to play, to do all these nice things. And even if he's 14 years old, and for a dog is considered to be senior and old, he's still a small dog. So their life expectancy can go a little longer than for bigger dogs. So we decided to start the chemotherapy. He didn't have visible signs of cancer, except the fact that he was diagnosed with it and the lymph nodes were swollen. But I mean, he wasn't sick, he wasn't lethargic, he wasn't feeling bad, in a word, So he seemed like a fine dog, like a healthy dog, which was recovering still from surgery, and everything seemed well. So we decided to start a chemotherapy. It's called the CHOP protocol, and it's 6 months. So the first month is the induction phase. They do every week. They give every week a different med, and also prednisone. After that, it will be another month, which will be weekly. Again, the same meds, they repeat it. And after that, it will be every 2 weeks, a different med. Hopefully he's gonna go into remission pretty soon. It was really funny because 2 days ago, he went up the stairs and by himself. and he was playing in his bed, like on his back and with his paws up. So he seemed happy, and he seemed to be doing better. But yeah, you never know for sure, and everything that you see like that, yeah, it's very nice and positive, and in the end gives you hope, you know, that things will be well. If you didn't see the first two videos, the first week he took he was administered Vincristine through the IV. Second week he was given cyclophosphamide through a tablet, and this last Friday he was administered Vincristine again. This week on Friday he will be given another med. So I will see what will happen after that as well, because it's the first time he's taking it, and every time it's a surprise. Yeah. The first time when he was administered Vincristine, he had some neurological effects. They say they happen very, very low in dogs. They happen more in people and cats. But with him it happened. And I can tell you, it was a little scary. I wasn't expecting it at all. I mean, with him, it happened in the past as well that he couldn't coordinate very well his legs. So then he was falling on his belly like a froggy. And then he was, of course, really scared that you cannot move anymore. And he was panicking. But that happened it wasn't too often. So what happened after the administration of Vincristine, they still say it's very, very fast because it happened in the same day. I don't know. I mean, it's a bit of, yeah, it's too much of a coincidence, in my opinion. But you never know. They say the side effects from this med should come in 24 to 72 hours. This happened in the first week after 5 hours max, and the next day as well. So I don't know. One thing, they administered it to the vein through an IV because it has the potential to damage the skin and the tissue. So it's the best way to do it, to administer it. They're quite toxic, this meds. So you should be really careful with every one of them. If you touch the saliva, if they lick you, and then you should clean that area. If you touch the feces or the urine or anything related to that. So going back to that, it happened quite often that evening. It happened the next day as well, and then during the next days it disappeared for good. Didn't happen anymore until he was administered Vincristine again. That happened last Friday. The first day he was well, nothing weird. He needed a little bit more rest, of course, but yeah, I mean, you go to the vet, they give you the IV, they give you other pills, they do an echo, so yeah, I mean, you're sick of it. You need to sleep, you need to forget about it, right? Then the next day, he was sick, he was nauseous, and he puked. Yeah, so the next day he puked. He wasn't feeling too well. He seemed absent, like looking in the wall or just looking, and you don't really know what's going on around you. He's getting an anti-nausea pill in the morning, but I guess it didn't work very well for him. It happened again to lose the balance and to lose the coordination of the legs, but not too often, just 2 times, I think, on Saturday. The next day maybe it happened once, and then it just became less and less again. Just sometimes it feels like his front leg just gets a little bit numb or tingling or something like that. Like what happens to you as well when you sit on your leg or arm for too long and it gets a little numb and tingling. It's annoying, I know. For the rest, again on Saturday, on Sunday morning he felt really sick and nauseous again. So then I had a discussion with the doctor, and we gave him the anti-nausea pill also in the evening. After that things normalized again. He felt better, normal. yeah, he started eating well. Now he gets only 4 grams of prednisone every day, so quarter of the pill that he was receiving in the first week. I think they will go with the same amount and same quantity for the last week, for the next week as well. That will be the last week with prednisone. So at the moment he's receiving a pill which helps with the stomach. He receives that anti-nausea pill, which helps also with the movement of the food and everything through the digestive system. So for everything to get metabolized and digested faster than normal, to help with that as well. He lost a little bit of weight. I believe he lost minimum 400 grams, if not a little more. And for a small dog, I think it's a bit, medium too much. I don't know. It's not too much, but yeah, he's losing a bit of weight. The blood count, the white cells went a little lower. He had a small infection last week, but with the antibiotics it went well, so it disappeared. The blood count, it went a little lower, but the doctor said it's normal for it to happen while being under this treatment, so nothing to worry about. Today he was nauseous again, so I think I will give him again after 8 hours the same med. So I hope that will solve the problem and he's not gonna be help with the nausea. For the rest, I didn't notice anything anymore. He doesn't have diarrhea, which is really good. He poops normal. Today he puked a little bit, but not too much. He puked the antibiotic. He still has to take for 1 or 2 more days. I don't really know exactly. He doesn't take gabapentin anymore. He had a big problem from it. He was really wobbly and almost like, I don't know, feeling like almost he was like a drunk person or something that cannot coordinate himself and almost falls down. So he's not taking that anymore. That was stopped completely. And now I will see for the next time and next met what will happen. That's called doxorubicin. So as far as I know, it has some side effects as well. It's one of the strongest meds pills that is, meds actually, that is given through this chemotherapy process. It's given through an IV as well. It takes quite long, between 20 to 30 minutes to be administered. It can provoke nausea and vomiting as well. So I have to discuss with the doctor if we're going to give him something more powerful against that. I have some other pills which are working well for nausea and vomiting, but they do have some side effects which are not very good to have in this moment as well. For the rest, what can I say? Wish me luck, guys. I hope that you're not going through this. And if you're going through this, to have the proper strength for it and not get discouraged and to keep being positive. And as much as hard it can get sometimes with all the side effects and all the problems that appear from it, I still see the light at the end of the tunnel, and I'm positive that things will work out and he will be well. And I know, of course, these meds have a lot of side effects. After the week, after he's going to be administered with doxorubicin, he will have a week without any meds to see exactly what happens with him, if it's better, if it's cheerful, if it's more, has more energy and everything, works well. We'll see how the blood count will be this Friday, hopefully good as well, and that it didn't drop too much, that he didn't drop too much in weight. If he did, to see a little bit what to do about it. He has appetite, so that's not a problem. He eats well. Maybe we do have to increase the portion to support a little bit what's going on right now with this treatment. So wish me luck. I'm taking right now a vet assistant course, so I can be more able to assist my dogs. I have 3 of them. One is Lucky, the Westie, which has lymphatic cancer. One is Bugsy, he's a French bulldog. He was also operated. He had some cystine stones in the bladder, and he's also allergic. So now we're trying to balance this with the problem that cystine stones can give. But if you want, and if you're interested in that, I can make a special episode about that problem as well. And at 12, yeah, he's almost 5 years old, so he's younger. And then a mixed breed, Nero, he's 12 years old, and he's the healthiest of them. I really believe the mixed breeds have more strength, and they're not the genetic problems don't affect them that much, because with many breeds of dogs, they are affected very much of genetic problems. So then all kind of related issues start to appear during life. Just as an example, the problem that my French Bulldog has with the cystine stones that he got, it's caused by a genetical problem. It's a mutation, and the cystine, it's not being metabolized properly. So then if the urine is not diluted enough, or if the level of proteins that he eats it's big, then it has the possibility to turn into crystals, and from crystals to stones. In the end, especially in males, in non-sterilized males, it becomes a big problem because it can produce blockages on the urethra, so they cannot pee anymore, which can give to a renal failure, which is also very, very dangerous for their health. They can die from it, especially if it comes, and it can become a vet emergency, like you need to do that surgery then, which is not very good. You want to be prepared and have a good surgeon and have a good anesthesiologist, especially with the French Bulldog, that they cannot breathe properly like most of the dogs, so you need to be well prepared for that. But we can talk in another episode about it as well. So for now, wish me luck, and as I said, lots of luck to you, which are going through the same process and through the same things, and I really hope they will be well and healthy and happy. That's most important. So have a very good week, and see you next time. Bye.